The greatest risk from osteoporosis is not the thinning bone itself, but the risk that thinner bones create for fractures. Injuries due to osteoporosis primarily happen in the areas of the hip, the wrist, and the spine. The hips are the major hinge point for bending and lifting. They house the largest muscles for jumping and landing. The top of the hip is made up of two components, the acetabulum, which is the socket of the hip, and the head of the femur. The upper end of the femur bone has an angle that we refer to as the neck, and the angle changes the forces that come down through the femur as you put your weight through your leg. Fractures of the femur usually happen in one of three places: the neck, the big broad bone to the side called the trochanter, or into the head of the femur that goes into the acetabulum. The wrist is built for tasks that require grasping, gripping, and pushing. It is made up of the hand, including the small carpal bones that join with the radius and ulna. Most wrist fractures occur at the end of these long bones in the forearm as you fall on an outstretched hand. This is known as a fouche injury and is an example of why we practice balance as part of our osteoporosis program. The most important and complex bone structure in the body is the spine. Your spine has 7 cervical vertebrae at the top of the neck, 12 thoracic vertebrae in your mid-back where your ribs attach, and then 5 lumbar vertebrae and the sacrum below that. The vertebral body is the most important structure to understand because that is the most common place for fractures to occur. While hip fractures and wrist fractures usually occur from falls and trauma, the spine is more commonly affected by compression fractures, which can be from a fall or from regular daily activities that produce pressure on a weakened bone. Compression fractures can happen from something as mundane as our everyday activities, especially if we have poor movement habits. Flexion or bending forward movements are often the cause of compression fractures, and they most commonly happen in the thoracic spine and the upper lumbar spine. These compression fractures lead to a remodeling or reshaping of the spine, changing its overall shape as a vertebral body becomes more wedge shape, as opposed to that square shape that it once was. This leads to a characteristic osteoporosis posture known as kyphosis. There are factors that put us at a higher risk for osteoporosis. Some of these factors are things we can control, while others are not. Caucasians and Asians tend to have a higher rate of osteoporosis. People who have low body weight are also more likely to have bone density issues. Family history is a good indicator that this may be an issue for you as well. If your grandmother was very kyphotic, you too could be at risk. After age 50, there are also hormonal changes that could affect your bone density, making you at greater risk for osteoporosis. With declining hormone levels, you do not deposit as much bone, and the ratio of bone breakdown to building could become negative, causing you to lose overall bone density. Women are much more likely than men to develop osteoporosis, but both men and women should be aware that hormonal changes, as well as other factors such as low vitamin D levels, can affect bone density. Certain medications can also affect bone health. It's important to discuss how your medications may influence bone loss with your doctor, who will be able to evaluate your risk and provide an appropriate prescription. Never stop taking medications without consulting your doctor first. There are risk factors that we have some control over, such as our activity level and our nutrition. Inactivity is not conducive to good bone density. Increasing your activity rather than avoiding it is very helpful. Eating a well-balanced diet is also something that we have control over that can help promote healthy bones.